The Oak Park River Forest Infant Welfare Society sponsors the Children's Clinic, a community-supported healthcare organization that provides medical, dental, and social services to children of families who are unable to afford the cost of private healthcare. Through partnerships with other community organizations, we support the physical and social well-being of children. Since 1916, the Oak Park River Forest Infant Welfare Society has provided healthcare services to children from birth to age 18. The Infant Welfare Society's role in the early years was to raise funds to provide clean milk to newborns and their mothers. From the milk stations in the early 1900s, the clinic has expanded and now provides medical, dental, and social services that focuses on health promotion and disease prevention. In 2008, the Infant Welfare Clinic was renamed the Children's Clinic, sponsored by the Oak Park River Forest Infant Welfare Society to better align the name with the mission.
2011 is a banner year for the Oak Park River Forest Infant Welfare Society as we mark the 95th anniversary of our organization. I'm proud to be president of the Oak Park River Forest Infant Welfare Society to continue our mission, along with the board of directors, to provide medical, dental, and social service care for children in need. Through a variety of fundraising events, both large and small, the Infant Welfare Society raises about 14% of the Children's Clinic annual budget.
The Children's Clinic is a healthcare safety net for families and is an important resource providing healthcare services to low-income children from 50 Cook County communities and Chicago. The majority of the clinic's patients are enrolled in the state's All Kids Medicaid health insurance program. The remaining patients pay on a modest sliding fee scale. Every family we care for at the clinic meets the federal poverty guidelines, and each year the number of children served continues to grow.
The Children's Clinic is able to meet the financial costs of these visits through the philanthropic support of individual donations, private and government foundation grants, corporate sponsorship, event fundraising, in addition to the statewide health insurance program All Kids and a modest sliding fee scale income revenue from the parents. What began 95 years ago as a clean milk station offering healthcare services 2 days a week is now a clinic providing care to over 3,000 children in the Chicagoland area. We could not have done this work over the last years without the tremendous support of the Infant Welfare Society, the board of directors, our medical and dental staff teams, and our staff, which now numbers over 35 people.
The Children's Clinic has been around for several years. I've been medical director for many of those. We serve a significant niche in our community. We are able to have a holistic approach to our medical practice here. Patients that are financially at risk are also at risk medically. So we are able to give them a very good overall medical home here. We're able to handle both their mental and social issues as well as the medical issues that some of these families approach us with.
In the early 1920s, the clinic decided to add a social worker to the staff. It was pretty cutting edge, back in the time to add a social worker on a primary care setting. And it's still to these days what sets the clinic apart from other primary care settings. During the well child visits, the social worker meets with the children, families, and if any mental health issues are needed to be addressed, they refer to me because I'm the bilingual on-site social worker, clinical social worker.
Our dental clinic is one of the few resources for high-quality dental care in the near western Chicago suburbs for low-income children. And we perform restorative care, preventative care, along with root canals and interceptive orthodontics. The administration here at the clinic is so supportive of excellent dental care. And I don't treat my patients differently here than I do in private practice, and all the dentists here appreciate that.
And the clinic is a training ground for the next generation of healthcare providers, as we are an internship site for the University of Illinois at Chicago dental programs. I myself am an alumni of the University of Illinois at Chicago Dental School, and they always were encouraging us to give back to the community. And after 5 years having served the Indian population on the Hopi Reservation, I decided to come back to Chicago and serve the people of Chicagoland. And so I felt very privileged to be able to work with the children at the Children's Clinic.
But one thing that I really do like about the Children's Clinic is whenever I have an emergency, they find room to fit me in. And that's something you need sometimes of being a single mom and your child is sick and you don't know what's going on. So to be able to get them in as soon as possible and get them out when I can, I really, really like that and appreciate that about the Children's Clinic. I love it.
I was hired last August to represent the clinic at area health fairs. I've also been working with preschools and daycare centers talking about issues on nutrition. I also coordinate the portable dentistry program, which last year reached over 1,250 students in Oak Park, Cicero, and Berwyn. One of the things I like most about my job is the excitement on children's faces when they learn new things.
The front desk is amazing. Whenever I have any questions, calling or coming in, they're really nice. I've called them at times when I was concerned about my daughter, and they helped me and relieved my anxieties and worries and gave me great information. And the doctors are really professional and full of information also, and have helped me out a lot with being a first-time mom with my daughter.
My approach to medicine is to treat every family as unique and individual.
We treat children from all over the world, and a couple years ago I saw a little girl, 3-year-old child from Poland who had just immigrated from Poland, couldn't speak a drop of English, and had extensive dental need, had abscessed teeth, and over 6 appointments we saw the patient. She cried throughout all the treatment, but we were able to complete the treatment. Well, last week I walked out to the waiting room, and Gabriella was greeted me and told me that she didn't need her mother back in the room speaking perfect English. And she comes back, we do the filling, she has excellent oral hygiene, and it's truly our mission is to take a child who is in that state and to go to good oral health.
Hi, I'm currently one of the co-presidents of the Oak Park River Forest Infant Welfare Society Auxiliary Board. The Auxiliary Board is the fundraising arm of the Infant Welfare Society, and together as a team we organize and execute both large and small events that generate funds that go to the bottom line for the Children's Clinic.
We are proud to support our mission through the Children's Clinic as it works to ensure a positive future for so many children as they grow into healthy adulthood.
As the Oak Park River Forest Infant Welfare Society celebrates its 95th year of dedication and support of the medical well-being of the children in its community, we honor it by singing, "Happy birthday